Like clockwork, Cynthia Bruner gets her mammogram and her flu shot every single year.
Now I think it's not just about protecting me, it's about protecting people that I love and people in my community.
13 years ago, Cynthia was diagnosed with breast cancer at the age of 53. She got the life-changing news after her husband of 11 years died. Cynthia would face another difficult moment, treating the tumor in her breast.
It had already moved out of the breast into the lymph nodes within the space of a year.
Stage 3 and aggressive. Cynthia would undergo chemo and radiation. Because of her compromised immune system during treatment, she made sure to get her flu shot and to get it every year.
I have two very close friends who are metastatic breast cancer survivors. I'm very mindful about how healthy I am when I am around them.
This flu season in the U.S. is one of the worst in a decade, with 21,000 deaths, and Virginia, one of the states hit the hardest.
The key thing is be proactive.
Dr. Mary Helen Hackney, an oncologist with VCU Health, says even as the flu season is winding down, getting the flu shot can reduce your risk.
It's towards the end of season, but it is so virulent right now, I still would suggest it.
For cancer patients going through treatment, Dr. Hackney says it's important they talk to their doctor about when they're at higher risk for infections.
If you're under chemotherapy, there are going to be certain times where your immune system may be more compromised and you may be more at risk for infection.
Dr. Hackney points out it's not always the flu that makes you really sick, it's the bacterial infection that could come afterwards.
So sometimes we see pneumonia after the flu, we see bad sinus infections after the flu, bad ear infections.
Dr. Hackney says whether you're a cancer patient or not, you should try to reduce your risk of infection by washing your hands often and staying home when you're sick. For Buddy Check 6, I'm Reba Hollingsworth.